with everyone. Thank you all, parents, administrator, staff, whoever's participating. I just appreciate you being here because, of course, this is a very important topic. Again, I'm Dr. Angela Floyd. I'm one of the coordinators for emotional wellness. My background is in both school social work and psychology. I've been with the district now for over 21 years. On our team, as far as our mental health team, we have Holly Saya. She's our General Director of Student Services. We have Michael Kelleher. He's the Supervisor of Clinical Care. We have Elizabeth Tanner. She's our Supervisor of Emotional Wellness. Myself. And then also our other coordinator, Leonice Reynolds Pearson. And then we have 7 mental health clinicians throughout the district, and they all have schools assigned to them. So they will be available to assist you with any concerns that you have with your students, with your children. So I'll share that information throughout the presentation as well. So today I hope you get a lot of information. Of course, Angela, again, at the end, we'll have Q&A. Hopefully I can answer many of your questions. The questions that I can't answer today, or if you need to contact me later, I'll have my contact information available at the end. So you can always email me or call me. And I definitely welcome your feedback and any questions that you have. So again, today we will talk about understanding mental health and how it impacts our children. So just to give you an idea of what are the objectives today and some of the things we are going to talk about, we're going to discuss a little bit more about typical versus atypical childhood development, warning signs of mental health concerns, trauma and mental health, interventions and strategies to assist, and again, wrap up in questions. And just keeping in mind too, I know given the climate that we've been in a pandemic, there's been a lot of different social issues going on as well. We've just been dealing with an election. So there are a number of things that may impact mental health. So I'll touch on a few of those as well. Many of you may have seen this movie. This is actually one of my favorite movies, believe it or not, as an adult in the mental health field, because it really focuses on emotions and some of the things that not only children go through, but adults. I just have a quick video clip. Some of you might have seen it, some of your children may have, but if you haven't, I highly recommend it. It's a really great movie. So in this clip, I just want you to think about this child, and I just want you to think about what you see.
Here we go. All right, open.
This looks new.
Think it's safe?
What is it?
Okay, caution. There is a dangerous smell, people. Hold on, what is that?
This is disgust. She basically keeps Riley from being poisoned, physically and socially.
That is not brightly colored or shaped like a dinosaur. Hold on, guys. It's broccoli! Well, I just saved our lives. Yeah, you're welcome.
Riley, if you don't eat your dinner, you're not going to get any dessert.
Wait, did he just say we couldn't have dessert?
That's anger. He cares very deeply about things being fair.
So that's how you want to play it, old man? No dessert? Oh, sure. We'll eat our dinner right after you eat this.
Right, here comes an airplane.
Oh, airplane. We got an airplane, everybody.
Okay, so you don't have to answer these questions, but think about Riley, this child here. This could actually be your own child, or you might have had some of these behaviors in your own children at some point. We just want to think about her behavior. Is it typical for her age? Why is she so upset? What made her behavior change? And I'll refer to Riley again throughout the presentation. So as we look at typical and what's not typical, just think about Riley. So I want us to take a look at typical development. Every child, of course, develops in key areas. Every child develops differently, but for the most part, all of the areas will be covered, and that's social, emotional, cognitive, physical, and language. When we talk about the social emotional, of course, we're talking about their ability to interact with others, including helping themselves and self-control. When we're looking at cognitive development, we're thinking about a child's ability to learn and solve problems. When we're looking at physical development, that does include fine and gross motor skills, and this is a child's ability to use small muscles and their ability to use their large muscles. And then lastly, when we're looking at communication, well, language, we're looking at communication, their ability to understand and use language. In all of these areas are very, very important. But for our purposes today, we will give an overview of the social and emotional stages of development, as it is an indicator for mental health concerns. When we talk about typical social emotional development, just remember that all children, again, they develop social emotional skills differently. If they don't meet every milestone for their age, that's okay. Just keep in mind that parents with multiple children, it's very hard to not compare. But again, just remember, just because your one child develops at a certain age, your other child may not. So we just have to look at those differences. So the first one, infants through 12 months, their needs are being met by crying. You see a lot of smiling, making some eye contact, responding to emotions, enjoying simple games. Then when we see our toddlers through age 2, we're beginning to see some tantrums. They may be a little defiant. Independence, they're starting to want to do things on their own. They're doing some imitation at this time. Parallel play is important during this time. And again, just think about Riley. We may be able to put her in that age range with the tantrum and just wanting to have her own independence. When we look at preschool through preschool age 3 and 4 through age 5, they're beginning to show more emotions. They're demonstrating pretend play. Friends are important. Tantrums are still going on, so they're not getting their way, and it doesn't just end necessarily at 2. So this could still be very, very, very common at this age. Again, showing their independence and wanting to be more helpful. These are just only a few characteristics. Of course, you can always look at all of the developmental skills and all of the other areas, and not just social emotional. And that is available through the American Pediatric Association, Healthy Children. There are a number of different resources that are available just to look at more detail. Here we're looking at the older children, grade school, ages 6 through 10. They're beginning to be aware of others' perceptions of them. They're expressing their feelings with words, but may have some aggression. At times they may be inattentive. Complaining about friends, sharing secrets. They may withdraw from family. When we're looking at middle school age, parents, many of you know this is a very tough age. So when we're looking at the ages of 11 through 15, they're beginning to think more logically. They're introspective and moody, needs privacy. Their friends are everything to them. They're valuing their friendships. They're testing new ideas. Their styles, self-identity, puberty is very important during this time. I also want to just, in this development with middle school and high school, I don't want to leave out an important identity that may affect minority students. And that's when we're talking about ethnic identity development. So oftentimes all adolescents are definitely struggling with their self-identity, but minority children may be dealing with some more struggles, just trying to figure out how they fit in with the rest of the world as it relates to their race or ethnicity. So we do have to keep that in mind. When we're looking at our high school ages 16 through 18, they're striving for independence. They're discovering their strengths and weaknesses, showing pride in successes. Their peers are influencing them again very easily. They're interested in dating and sexual relationships during this time. Here we have our atypical development. I know when looking at typical, it's very easy to do the comparison, but again, you can also do the comparison with the atypical development as well. So they're exhibiting behaviors that fall outside of the normal or expected range of development. And that's why it's considered atypical. So for children younger than 11, you may see frequent stomach aches or headaches, not related to a health condition, repeated actions or increased fear, inconsistency in sleeping patterns, constant motion and cannot sit still. When we're looking at our older children, 12 and up, there may be periods of highly elevated energy and activity, and they may require much sleep than usual. You may see a change in sleeping patterns, hallucinations and delusions, possibly engaging in self-harm behaviors like cutting or burning their skin. So some of these characteristics you do have to remember, again, not to compare to typical, but these things must interfere with their day-to-day functioning, how they interact with others, how they're demonstrating progress. You could see a decline. So if these areas are constant, that's when there's a concern. So I can't go throughout the presentation. We're talking about stress. Of course, we all have stress and how it impacts our mental health. And I know, again, as I had mentioned before, we have been in a pandemic for quite some time since March. There has been a number of different mental health concerns with not just children, but also adults. So, you know, of course, many people have lost family members or friends due to COVID. Some people may be dealing with that right now. Many people have lost employment. There's financial stressors. There are a number of different things that have impacted families, including the social injustices that have occurred with race. Now we've dealt with the frustrations and overwhelming responsibility of helping our children understand that that things are going to look different. They may not go back to school. Some kids had to, they really didn't have an option. They are doing e-learning, and some kids are in person, so maybe they're not seeing some of their friends they saw before. So there's been a lot of things that families in general have had to worry about, and just really try to balance that. I put this quote here because I love this, and it's the greatest weapon against stress is our ability to choose one thought over another. We're constantly just thinking about all of the things that we're dealing with. So it's very important to help children understand how to cope, and that's a big part of worrying. So they just don't have those examples of how to handle stress. So when we're looking at mental health, there are different areas that we can focus on. There's a difference between mental health, mental distress, mental health problems, and mental disorders. This information I'll also be able to provide to you. I have a handout that I can send Angela, or we can email that information to you. So when we're looking at mental health, we're looking at a person's condition with their psychological and emotional well-being. Just having the capacity to deal successfully with life and adapt to challenges, both positive and negative. And we all have mental health. It's the life that's created for us. So that's good when you have mental health, because it's as long as it's positive and you're managing those stressors, you can successfully get through life, and just learning how to cope with some of the things that you may be dealing with. When we look at mental distress, it's the inner signal of anxiety or stress that a person may have when something is wrong in the environment. And it could be anything from not making a sports team, not getting a job. Everyone experiences mental distress. When we're going and looking more deeply into mental health problems, it could cause so much stress that it can lead to mental health disorders. So when we're looking at problems, we're talking about larger stressors than usual. Some things are just a part of life, like grief due to death of a loved one or serious physical illness. Everyone does experience mental health problems and may need support, but being able to deal with those issues effectively and successfully will determine if it can lead to further problems such as a mental disorder. Of course, when we're looking at mental disorders, which is also referred to as a mental illness, it is a medical condition, and it does involve changes in emotion, thinking, or your behavior. It could also be a combination of those things. They are associated with distress and problems functioning in your social environments, your working relationships, your family relationships, different activities, and diagnosis must be given by a mental health professional or by a trained professional under this certain criteria. So those are some differences. And again, I can share that information with you. Here, I just wanted to give some facts that's seen within the United States. These are facts and statistics that it has been collected over a few years. I would say the last few years. The data is collected from a number of different organizations. Some of you may be familiar with, of course, the CDC, the National Institute of Mental Health, the Substance Abuse and Mental Health Services Administration, the World Health Organization. And then there are several more not listed here, and you again can always get that information. I can always get that information to you. But these are just some very alarming and statistics that I want everyone to just be aware of. Mental health problems affect about 1 in 10 children and young people. Nearly 1 in 5 adults experience some form of mental illness in a given year. 11% of children under 5 suffer from anxiety disorders. ADHD is one of the most common childhood disorders. Globally, depression is one of the leading causes of illness and disability among adolescents. Death by suicide is the second leading cause of death among 15 to 34 years old, as young as age 10. LGBTQ youth are 4 times more likely to attempt suicide than straight youth, and 1 in 4 high school students use e-cigarettes in the last 30 days. 1 in 5 high school seniors misuse prescription drugs, and vaping of both nicotine and marijuana use continues to increase. So these are ongoing in our society. Some of them, many people are aware of and some people aren't. So I just wanted to share that with you. Here's a list of some of the major mental health disorders that impact our youth. A lot of their information can be found in detail through resources that I can provide to you again. But just to go over a few of them, again, we have attention deficit disorder, ADHD, anxiety disorders, bipolar disorder, depression, eating disorders, psychosis, and substance use disorders. There are many other diagnoses that are not listed here. Many of the diagnoses are commonly among youth in the United States, and oftentimes there are many misdiagnoses. So some of the information may not be available or it makes it harder because of the misdiagnosis. Some children are not impacted because it's not reported. So the information you see is constantly changing. So just keep in mind that many children, again, are misdiagnosed, and you have to be cautious with that whenever they are going through different treatments or when they are seeking help or when you are seeking help. That's why it's important for it to be ongoing. A child who may be later diagnosed with autism can show signs of a developmental delay, and with interventions and treatment prior can look totally different in a couple of years. So those are some important facts to remember. These are some signs and symptoms of children who may be at risk for developing a mental disorder. For younger children 11 and under, prior to middle school, you may see some of these characteristics. And again, just remember that the characteristics listed must interfere or hinder with their ability to progress in their daily functioning, and they're demonstrating lack of progress developmentally. So it has to be something you're seeing on a consistent basis. The first one, frequent tantrums or intensely irritable much of the time, often talking about fears or their worries, frequent somatic complaints, constant motion and cannot sit still, inconsistency in sleeping patterns, lack of interest playing with other children. And again, just think about the difference with typical development versus atypical development. So these are some signs and symptoms that are identified in children 12 and up, in adolescents and older children. And again, I have to continue to remember, to just emphasize the importance of knowing it has to interfere with their ability to progress daily, with their day-to-day functioning, how they're interacting with others, and just remembering that it looks totally different from typical development. One of the things that you may see is a loss in interest in things that they used to enjoy, spending more time alone and avoiding social activities with friends or family, hallucinations and/or delusions, engaging in self-harm behaviors, for example, cutting, smoking, drinking, or using drugs, having thoughts of suicide, and commonly fear gaining weight or diet or exercising excessively. Before moving on to childhood trauma, if many parents are not sure if some of those characteristics should be a concern, or, you know, how do I know it's typical? I think it's typical, but what if I'm not sure? If you are questioning that, or you're very concerned, or just want to know if you're overthinking it, always go with your gut. It is better to consult with a professional just to make sure, other than just ignoring it, and just document those behaviors that you see. So now we're going to look a little closely at childhood trauma. We've talked about mental health concerns, but as we continue to address these issues, a lot of times children are experiencing some type of trauma, and that could be one of the causes. So in the next few slides, I just want to discuss what trauma looks like. What is trauma? Trauma is a response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of helplessness, diminishes their sense of self, and their ability to feel the full range of emotions and experiences. And just looking at this definition, we can take a look at the condition that we have been in, again, with the pandemic. It has been very traumatic for some people. So it's been scary. It's been shocking for some families, especially, again, who have contracted the virus, or who have lost family or friends. It can interfere with your mental health if not treated. So trauma is very, very important to pay attention to. It can lead to a mental health disorder. For example, a child or adult can experience a traumatic event such as violence or some type of abuse, and it can lead to depression, and or anxiety or PTSD. So those are some signs we need to really be alerted to. These are types of traumatic events that one may experience: a life-threatening and terminal illness, infectious disease outbreaks, again, the coronavirus or swine flu as an example, acts of violence, which can include assault, abuse, terrorist attacks, mass shootings, natural disasters, for example, hurricanes, earthquakes and floods, car crashes and other accidents. And we won't be able to discuss it today or in this particular training, but another significant concern that has arisen is racial trauma as well, just dealing with some of the ongoing social injustices that continues to occur within the Black community has been very overwhelming and stressful and traumatic for many people. So we have to also just look at everything when we're looking at trauma. So as we look at signs and symptoms of trauma, these are just some images and characteristics you may see in a child who has experienced some type of trauma. Just keep it in mind, again, it looks different in every child. Many of these signs and symptoms are common in mental health disorders as well. So it could be worrying, feeling very anxious, sad, or fearful, crying often, difficulty sleeping or having nightmares, really just being upset and thinking clearly, having frightening thoughts or flashbacks, or just reliving an experience over and over again, and feeling angry, resentful, or irritable, becoming isolated with family and friends, or even avoiding places or people that bring back some of those disturbing memories and responses. So again, it's important just to seek help. If you're not sure, it's always better to consult and make sure. There are several ways that we can respond to trauma. Just remember that, again, it affects everyone differently. Parents, first of all, you need to take care of yourself. Children depend on us, and I say us because I'm also a parent. They depend on us for safety. They want to feel safe, even if we can't ensure it sometimes, but they just want to know that they feel safe. Your anxiousness and fears can cause more stress. You want to stay calm, find ways to respond to outbursts, and try not to make things worse. It's really good to speak in a lower voice. Try not to yell or show aggression. Being patient is very important. It's scary, and it may take a very long time for a child to feel safe again, especially when they've experienced a trauma. Sometimes it can take months, sometimes it can take years, and it just takes a while to learn to gain that trust. Pay attention and try to find out what makes your child anxious. Learn to avoid or lessen those triggers if you can. Reassure them that steps are being taken just to keep them safe. You want to constantly encourage them, have conversations, and try to get them to talk or ask questions. But again, if they don't want to talk, that's okay too. Let them feel the way they feel. You can teach them words or to help them describe their feelings. You can show them acceptable ways of dealing with feelings. Try not to take their behaviors personally. When your child is keeping you at a distance, then you just want to be available and responsive. And more importantly, ask for help. There are so many resources available. There are support systems in place to assist. You don't have to go through this by yourself. There's ongoing support within the community or even at your child's school, and we'll talk a little bit more about that. In response to mental health, I know many of you may have the information or a little of the background. Our district initiative on the mental health plan really came about through the 2018 Florida legislature, and that is unfortunately was due to the Marjorie Stoneman Douglas shooting in Parkland. So as a result of that, funds were allocated to our state to support law enforcement, and provide different trainings as well as mental health services to students. So our state bill requires that the Department of Education focuses on mental health awareness, prevention, and intervention. So I'll just go over some of what those programs look like, and these are what we're doing in our district. And again, if you just don't know, you can always ask some of your student services staff. And when I'm talking about student services, I'm referring to the school psychologist, the school counselor, the school nurse, school social worker. Excuse me, the mental health objective is to increase awareness of mental health prevention and intervention, violence prevention, and promote mental health protective factors. We're providing youth mental health first aid to all employees in our district. As an ongoing goal. We have a huge district, so it's a lot of employees to train. But we're constantly doing that and making sure that just some of the staff at your school, teachers, even down to a custodian, cafeteria worker, everyone needs to be aware if a child is in distress that they may need some help, and just be available to offer them some support. So we're just providing that training just so that they know what some of those signs look like. Delivering Act Now presentations. These are presentations provided by the student services and the teachers, and this is just to share information about violence. providing mental health online training resources called Cognito to staff. These are just, again, a number of different trainings we're offering in the district for staff to be prepared and work with students. Providing training and resources to students and staff on Sandy Hook Promise initiatives. And I know things have looked different again since the pandemic, but there are clubs at the school. Once everything does resume, there are different clubs and organizations being offered to students that help support mental health and to encourage just emotional wellness. So we do have that available. Again, these are more evidence-based, the social emotional learning tools for the classroom, small group counseling lessons that are being provided. Every elementary school will have the Second Step program. These are some of your teachers are providing these social emotional learning skills to the students. They're training student services staff to work on a curriculum to help with mental health. And these are some of the things that we continue to do in the district. So before leaving, more importantly, I just want you to be able to know how to access mental health services at your child's school. Anyone can actually initiate services for their child, starting with they could do a self-referral. Your child can go to a school counselor, a social worker, an administrator, and let them know that they're needing support. A school personnel can offer that support and make that referral. Parents, you can contact the school if there's a concern, or even a friend of your child can make a referral or just let someone else know that they're concerned. You can contact, again, the student services staff that I mentioned. Once a staff member is contacted, he or she will access, all of the information that's needed to help support your child. They will determine the level of intervention that's required. Some of the intervention can start just right at the school, where it could be crisis counseling, family consultation, a small group at the school. Some schools are offering that for students. It could be individual school-based counseling, or we also have, again, I mentioned earlier, we have our mental health clinician, so it could be one of the mental health referrals. Just depending on the level of intervention, the student services team, they will continue to consult and refer to community resources and then provide additional resources that are outside for individual therapy. These are some of our community partnerships that we have with several agencies. So let's say that you are interested in your child receiving counseling. There's been some steps made at the school that hasn't been successful. You're still concerned and you're worried. You've actually tried to go through your own insurance, and either it's not covered, or your insurance deductible is too high, or it's becoming too costly, and you know your child needs this service. We do have a partnership from that mental health plan that I shared, where it doesn't matter if you have insurance or if whatever the insurance is, your child can receive the support that they need with mental health counseling through any one of these agencies. That referral is made through the student services team. They will contact the mental health clinician and get those services initiated, and a provider, depending on what the needs are of your child. We have here Chrysalis, Northside Mental Health, Success for Kids, DACO, Crisis Center of Tampa Bay, Grace Point, and HEADS. Depending on the needs, one of those providers will be able to support your child. And I will say things, of course, I have to constantly refer back to the state we're in the pandemic. Many providers have been only giving telehealth or teletherapy, where it's online or it's virtual. For some students, that works very well, depending on their age. And for some, that is not going to work. To get a child to sit in front of the camera and share how they feel or things that they're dealing with emotionally can be quite a bit of a struggle. And in fact, for some cases can make it worse. So we are slowly finding out that there are more providers beginning now to offer the support again in the school, because initially, before all of this, they would either come to your home or they would come to the school to provide services for your child. But because, again, the pandemic, those services were limited. So now there are some that are beginning to offer that type of support again. But I just wanted to let you know that you may find more telehealth at this time until things change. But these are the services that, these are the providers that we do have through our district. So before, any of these referrals take place or while all of these things are going on, we know that your child is coming home. They're at school, but they're also at home. And these are some behaviors or things that you may see that you want to work on at home with them. You can definitely, more than anything, I think is very important, is document some of the behaviors and triggers or when the symptoms occur. Because sometimes it may not be a mental health concern at all. It could be something that is making them upset that you're not aware of. And if you're starting to document those behaviors or when it's happening or the trigger that's causing it, then we can narrow it down a little bit more. So you want to really pay attention. Talk to your child, listen to them. Think about significant environmental or family changes. Again, anything that is going on in your home, sometimes we don't realize, but children are listening. You could be having an argument, or you could be overwhelmed or frustrated financially, and you're expressing that and they're hearing it. So then it's causing them some anxiety or some frustration or fear or not knowing. So just pay attention to some of those things. Pay attention to peer relationships. I can't stress enough, and of course we all know social media accounts can really, really be disturbing, can be very frustrating, overwhelming, and can cause a lot of emotional distress that's not needed. So you really want to just know what they're looking at, or how long they're looking at some of these social media sites. Many of them could be up 1 or 2 o'clock in the morning and you don't know that they're on their phones or looking at social media and all of the information that's out there. They have so much access to anything and everything that they want to know about. They can access it. So it's not like how I grew up. What you don't know is what you don't know. So now, of course, those things have changed. So we just really want to monitor that. Talking with your child's pediatrician is always very important. When looking at some of the mental health illnesses and concerns, or even with trauma, you always want to rule out a medical concern, because it could be something going on medically that's causing some of the behaviors that you see. So it's always really good to rule out medical and consult with the doctor. Doing fun things, stress relief is so important. A lot of them may not know how to do that. Exercising, playing a sport, arts, games, reading, outings, movies. And again, things have changed. Things look differently. So sports may not be available for some right now, or maybe limited. So I think it's been really challenging to come up with creative ways. But again, there are resources out there. Just looking into it more, you may be surprised what you find. Tips for parents at school: you definitely want to be in communication with your child's teacher. They could be noticing something at school. I know a lot of students right now are in e-learning environments, and for some it could be very, very stressful for some students. I know some students have adapted well to the e-learning and some have not. So that may be a huge impact. And so it's really important to communicate that with your child's teacher. Again, student services staff are available. You want to ask for mental health resources, reaching out to parent services. We have parent liaisons throughout our district who are assigned to schools to help provide that support and advocate and give you community resources. Again, Angela Fullwood is available. She has a number of resources to help provide support as well. These are some community resources. Many people are aware. Of course, you can call. I think we indicate this a lot on our district website, or we have shared this before, but calling 211, when you do that, they can dial, or they can connect you to a number of different resources within Hillsborough County. just to get you to where you're trying to go, even though you may not know directly. If you just tell them what the concern is, they can guide you with that. Also, crisis text line, texting to talk, that's available now. The LGBTQ crisis hotline is available. We have here the National Domestic Violence Hotline, National Suicide Prevention Hotline, Child Abuse Reporting Hotline, Sexual Assault Services. And then through your employer, many organizations or many employers offer employee assistance programs for counseling. I know our district offers that for our employees. So those counseling sessions are, there are a limited amount of sessions, I think 5 or 6, just based on our district, where you can receive counseling for free before you decide if you want to continue, or before the insurance picks it up, or private pay. So that's something to definitely utilize or ask to see if your job does have it. So I think that concludes the presentation. I hope I was able to share some light or some questions that you may have. And right now, this is the perfect time. We can open it up for additional questions.
All right. Thank you, Angela. That was so powerful and informative. Thank you so much for that. And I see we do have lots of questions. So let's dive right in. I'm going to start over here in the Q&A. Atypical development with children, 11 and under. If they have a child who has difficult time sitting still or relaxing in silence and an ability to sleep alone throughout the night, could this be an indicator of an underlying issue? Or how can I get him or her to open up about what they are experiencing without making them feel insecure or feel like something is wrong with them?
Okay, that's a very good question. It's so hard, that age, and when you're looking, or we're talking about children in general, so of course there are a number of different characteristics and behaviors that they're affected in so many ways. They could watch something and can't sleep, or become irritable, or they see something, anything, or they've heard a conversation. What you want to look at or pay attention to is a pattern. If you're seeing this is consistent, I mean, it's continuing weeks in and out. I mean, this is not like, oh, you just happened to notice it last week or one night. This is an ongoing issue. This is not stopping. It's not getting better. As far as talking to your child, depending on how your child is, some kids are fine with opening up and sharing their feelings, but a lot of times, 11 and under, they may have trouble with that. And you can be very creative. I can get some information regarding certain books that helps with feelings and just opening up and sharing about emotions. There's some really great children's books that focuses on just that mental wellness, or some fears or anxieties, and in a very cute way that you would be surprised after reading that story that your child may open up. So again, I think more than anything, just really document, pay attention. If you're seeing this on a regular, consistent, I mean, we're talking weeks and months, and this is going on and not stop. It doesn't matter what it is that you're doing to try to intervene. You're very concerned. I would really talk with a professional, and I say professional. It could be, you could start with your pediatrician to make sure that there's not a medical concern going on. You can, when you're talking about not being able to sleep and being irritable, I mean, you can look at diet, you can look at what time they're going to bed, you can look at if they're looking at social media or screens, and, some things that could be impacting them, to just see where this is coming from. So I don't know if I answered that question or not. Hopefully I did. But I don't think it ever hurts to consult with a professional if you see this is consistent and this is going on. And
okay, and there was one that was similar that was asked in the chat. And if you want to, the one in the chat, Ms. Curry, if you want to, I feel like those two questions were a little the same, but if not, you can definitely go in the chat and ask it again. There's one about, is ADHD something a child could seek therapy to cope with and potentially grow out of, or is this something a physician would seek medical assistance for?
Okay, when we're talking about ADHD, it really depends on, I will have to say that many parents may choose to go the medical route where they're seeking medication to assist depending on what's going on with your child. Then there are many parents that would rather go an alternative route, more natural, where they can either change their diet, certain things that they're doing to assist with those behaviors. So it just really depends on what you prefer. But I want to, let me just say this. It's very hard to say if your child will grow out of that because there are many adults who had ADHD or have been diagnosed with ADHD or ADD as a child. And there are some behaviors that look very similar as an adult. It may not look the same at all, so it presents differently. But I would definitely seek medical advice just to kind of see where you want to go with how your child is doing and how they manage their behaviors. And depending on how old is the child? I don't know if she's answering or in the chat.
I think that was someone else. The one who asked the ADHD question, could you please type in the age of the child, please? You were in the Q&A section. Would you please type in the age of the child? 8. Thank you.
Okay. And then just out of curiosity, has your child been diagnosed with ADHD?
Could you answer if your child has been diagnosed with ADHD?
The reason, well, she doesn't really have to answer. If your child has been diagnosed with ADHD, a lot of times they will refer to seeking therapy, whoever made the diagnosis, because the therapy can help assist with how to control certain behaviors, or helping them to understand it better, and possibly just learning different ways to cope with it. Because of course, it could look totally different in the classroom than it does at home. So just really finding out what's best for your child would be my best advice, only because it looks so differently in every child. But I know that many kids are getting therapy that helps support just really those behaviors, and it's more like behavior modification. So behavior therapy and helping them to be able to attend better. Some other things that they use to help manage just either not sitting still, but participating in different activities. They may have other tools that they use in the classroom that assist with that. So there are a variety of different ways of helping to control those behaviors.
Okay. Thank you for that. I have another question. How would you suggest handling the social media concern when you're in a blended family and the other household allows it and doesn't manage or review it either? Is it fair to set rules and guidelines in your own household, even if they don't align with the other household? And how does one successfully implement new rules at their own home without creating resentment or bitterness in the other child? So resentment toward them as a parent and also toward the other children. Yes. That's a great question.
That is a very great question.
Wow.
That I will say this, it makes it challenging when you have two separate households and two different rules. I know it has been very helpful to help your child to establish what is okay in our home and this is what's okay in this home. So I know it makes it very hard because now they're trying to figure out, well, how are they supposed to act in one and how are these rules here, especially if the parents are not both agreeing on those same rules. So that's what makes it challenging. But it's the same way at school. When you're in the classroom, you tell your child, this is how you behave in the classroom setting. Your teacher's expectations are this. When you're at home, it's different sets of expectations at home because now you're no longer in the classroom. So it's almost like you have to tell them, okay, here at our house, these are our rules, and these are the rules I want you to follow. And I don't know if talking to that other parent or the other household, letting them know that these are the things that you are initiating or these are the rules in your home will help, because all of those relationships, they can be very tricky. And can cause, again, a lot of resentment, especially when you have siblings. But if it is really interfering with your child's behavior or day-to-day routines, being successful, and you're seeing that it's causing more harm, then I think it's a really good idea to have some type of rules established in your home. And I don't know if possibly the other household would want to at least listen to your concerns, because I know every relationships and all of the dynamics with blended families can be very tricky and cause a lot of emotional distress and more problems. So I don't, I'm sorry that, I wish I could have a direct answer to help assist with that. But I really think it is a good idea if you can have some set of rules that's being followed in your own home.
Thank
So
you
I
for
don't know
that.
if that assists.
Thank you for that. My son is 6 and he gets upset very easily and he doesn't sleep well. Is this a typical atypical development?
Well, how long has it been going on? When you say don't sleep well, is it just, is it every single night they're not sleeping at all, getting very little sleep, very irritable? So those are some questions that I want to, because this developmentally, children that through this age go through so many different transitions, and it's an ongoing thing. One week they may be sleeping well, and next week it's not. Or did there something occur before going to bed? Or it's so many different questions to
So,
be able to say that it's atypical. Just from what you're telling me, it doesn't sound atypical. But if you're telling me if this is an ongoing problem, you know, waking up in the middle of night, it, there are so many different characteristics that could go along with that. I'm really curious.
okay, if you can text in the or in the Q&A, I'll go on to the next question. My son
Okay.
has ADHD and excessive eating. He does not know why. He eats in the middle of the night. Another thing is that when he loses his anger, he snaps and goes and starts throwing and cursing. He says bad words to the parent and says he wishes he was dead and wishes that the parent was dead. How can the parent deal with this? And the child is 9 years old.
9 years old. I really think that you're at this age and what you're describing, it sounds like your child would benefit from maybe some play therapy. Um, Play therapy is really helpful with young children, at least 11 and under, just to help them really identify what they're feeling. And I know there are a lot of play therapists that are really creative in doing this. It's not so much talking going on, but a lot of creative ways through play that they're helping them to identify what they are feeling and their frustrations. Um, it just from the description that you're telling me, that is something that I would recommend. I can give you some information, or if you could send me an email or a way that I can get in contact with her, I can give her some resources to look into, because I think that would be very helpful.
Okay, so and Dr. Floyd's email is listed right there. So would you
Hmm.
reach out, that parent who just asked that question, please reach out to Dr. Floyd about further information. This
Yeah.
is a really good one, Dr. Floyd. This parent wants to know how to reach an 11-year-old boy that really refuses to participate in therapy. He and his brothers
Mm.
were involved in a car crash that killed their daughter,
Oh,
and he is
wow.
shut down.
Oh my gosh. Wow. I'm so sorry to hear that. Um, this is, oh my goodness, that's a lot to deal with for his age and just in just your entire family. Um, we do have a number of different they're grief counselors, but it is really neat how they have it for children. And I have to give you that resource. If you could email me as well, they are really good with working with children who have lost loved ones. And they do it through art, they do it through different music activities. I don't know what has changed since the pandemic, or if there's more things virtually yet, or how they're actually providing those services, but it is a great resource to help deal with losing a sibling or a parent. I think it will be very helpful. I think it definitely needs to be addressed. I don't think that without counseling, your child will continue to decrease those behaviors. It seems like it could continue to get worse if he doesn't have anybody to talk to, or at least to express those feelings.
Thank you for that.
But yes, please email me, and I definitely want to get that information. It's a really great resource.
Okay. I'm going to go to another question in the chat. I have recently taken in my niece and nephew at the beginning of this school year. They both experienced extreme trauma, and I am very concerned with the school counselors. I'm
Hmm.
sorry, connected with the school counselors. I'm sorry. I'm very connected with the school counselors. But do
Okay.
you have any advice for the extended family member taking care of them? For an extended family member taking care of them?
Oh, okay. Just in general, and how to communicate with them, or just how to deal with some of those issues.
Yes, I would think so, yes.
Okay. How long have you had them, or has it been? Is it fairly recent?
Um, could you answer that, please, Miss Tiffany? Since August.
Since
And
August.
mhm,
Okay.
I have
Oh,
been in their lives forever. So,
oh, okay.
okay.
But they've recently, and the reason why I asked is because just to see a timeline on how well they've adjusted, because it seems like they could still be an adjustment period if it was. I mean, August wasn't that long ago. Um, and it sounds like you're trying to do everything you can just to offer them the support, but it just may take a while because that's a big adjustment to make a move, especially if they've dealt with trauma. Are they getting any counseling or anything right now?
Um, are they getting any counseling? Oh, they are from Tennessee. They moved to Florida in the Panhandle, then down here in August. Both parents are addicts. Unfortunately, their insurance does not cover counseling. So
Okay.
I'm assuming they
So
don't get counseling.
Okay, so this is perfect for our mental health clinicians to get them connected to one of our providers. The ones that I had mentioned through the presentation can really just take a look at what their needs are and offer that support. Um, if you don't mind, and I guess I'm just asking whoever is speaking to, if they can email me, and then I can give you the correct resource. Also, if you said you are connected with the school counselor has the mental health clinician contact to set up those services. And that may be something, if you are speaking to the counselor, to let them know you are interested in a mental health referral
Okay, she did
for them.
say this presentation was very timely. The school psychologist told her about this, I guess, this presentation yesterday.
Oh, good. Okay.
So, but I think that information about the clinicians would benefit as well. I
Yes.
did want to Dr. Floyd. I know one of the things we're working with also in our district, it hasn't been solidified, but we are working on caretakers of children with mental illness or people with mental illness, and providing our families the
Oh,
caretakers. And so, I know your job is all about the students,
right.
the growth of the students. But to her question, is there some advice or some help for the caretakers, because the caretakers do take on a lot. And so
Right.
my department, we are working on that connection for parents of children that of children with mental illnesses, just because that is a support that the parents need as well. Like, so we're really
Yes.
trying, and as soon as we get that information out, we're gonna put it out there.
Oh, good. Okay.
So yes, that is something. It's not official, but we're in the
Okay.
works of it. Yes. Here's another question. My elementary school age child is displaying traits of anxiety. We have a family history of anxiety, and her behaviors are becoming consistent and more prominent. We
Mm,
have divided home dynamics and are in the middle of custody issues with the child, and the child is starting to put up walls and avoid topics of concern. I worry that my child is developing unhealthy mental health traits and coping methods. Is there a way to create a healthy space where my child can build stronger coping mechanisms?
oh, that's a good question too. Um, there are so many different resources to help support like coping mechanisms. I know it's not something that's easy. I will be honest with you. It doesn't happen overnight. It takes a lot of patience, because now you're trying to help them learn as a child how to deal with their emotions, and they don't know how to do that. But it is, it's possible. I'm not saying that it can't be done, but just really a lot of patience, taking the time to show them, maybe doing some type of other activities with them. I don't know if they're involved in any type of sports or extracurricular activities. As far as the anxiety, I know some students do really well with learning how to breathe, learning some breathing techniques. We have a lot of those apps like the Calm app, just really helping them with mindfulness and taking the time to not worry. It's hard to teach them that because their little minds, it's a lot to take on just for adults. There's always, and I always refer to making sure that there's no medical things going on. So I don't know if you've had an opportunity to talk to a pediatrician, if there's anything else going on, just make sure. And then of course, even though we suggest counseling or therapy, it doesn't always work, because, now you're asking them to speak to a total stranger that they don't know, depending on the age. So it's an ongoing struggle. And I really empathize with just that frustration. But I can, again, give you additional resources in dealing with some coping mechanisms, just with anxiety in general. If you think that is what the main concern is, I can share that information. And in this presentation, I can also provide some of the resources that I had given before when I've given this presentation. And it does have some of those tips to deal with anxiety or mental health concerns in general. Just some coping mechanisms and ways to just really talk with them during stressful situations, because they do have to have some ways that they can handle stress, or some fears that they may be having. And then again, I highly recommend play therapy for a child that's at least 10 and under, because they may not know how to just speak those things out. They communicate it effectively. So when you have a play therapist, it looks like they're playing with them, but they're not. I mean, they're getting a lot more than what you can imagine. A lot of resources are very helpful with books, a lot of children's books now that I'm really happy to see that there are a lot of children's books that if you type in children's books on anxiety or emotional wellness or depression, somebody has written a book catered to the child's age, where if you read that story or consistently read these types of books, it may help them deal with some of these stressors or help them to cope. So those are some unique things to do as well.
Hmm. Yeah, there are a lot of questions in our chats about that. Here's one
Okay.
that for middle school, are there any support groups for middle schools for the kids with ADHD specifically?
I will actually have to find out. I'm not sure because that's such a specific group for that age. I will have to find out more if we have, not we in general for the district, but in our community, if there is something right now that's being offered. I know throughout the, randomly throughout the year, we'll get some emails or some information on a group that may be going on, but it's so specific. So if you also can email me, then I can find out more if there is something like that available right now.
Okay.
That would be a great support group.
Okay. I think I have two more questions.
Okay.
Um, I have a 6-year-old, wakes up every night, usually 2 hours after going to bed, working on the working with a behavior therapist and seeing some improvement. However, anytime she doesn't get her way or is asked to do things that she doesn't want to do, she throws a huge tantrum, screaming, throwing things, sometimes even hitting. Is this typical behavior or is this something more serious?
When they let me ask you, why has she been referred to a behavior therapist? Or who was that? Just something that because those type of behaviors started, or was there something else going on and then it's gotten worse?
Um, Attendee, could you answer that question, please? In the
Yeah, I'm just trying to see, has the behavior gotten worse since the behavior therapist, or were these behaviors ongoing prior to the therapist and that's what they're working on?
I'll wait for the answer, but I'll go on to
Okay.
another question until we find that out. I have a
Okay.
14-year-old son who has been threatening to harm himself. I've tried to talk to him to get to the root of the problem. He says he feels like he is not benefiting from life. He
Mm,
has recently learned that one of his female friends suffered a trauma as a child, and I believe he has taken on that burden in order to be supportive for her, but he is not emotionally mature to handle that. This is a
right.
14-year-old girl who he cares about, but I'm constantly fighting the whole girlfriend title. Not to mention, I feel as though he suffers from abandonment and rejection from his absent father, but denies that how he is feeling has nothing to do with his dad. I'm in the process of seeking professional help through counseling.
Okay. So you're in the process. So you've already contacted someone for therapy for him, or because I if your child is saying that they want to harm themselves, then that's urgent. Um, I don't know how often is he saying this? Has he shown you any other signs? Has he made these attempts? Does he have to be monitored? Do you have to be in the room with him, or you think that he's going to hurt himself?
I'm waiting for them to respond.
Okay. When we're talking about, and since she brought that up, when we're talking about self-harm or any type of suicidal ideation, if
No,
these,
oh, I'm sorry. No attempts, no other signs. I do not believe he will hurt himself,
okay, okay.
but he's saying
Um,
it.
but he's actually saying it. Okay. So okay, well, that's good to know. If at any point you do feel that there's a possibility that he will harm himself, that is a urgent crisis call. You can call 211 or you can call 911, but they can definitely assist with that. But if he's talking about it, he's thinking about it, he's not happy, he's dealing with a lot, he's got a lot going on. So I mean, he
I'm not sure if we lost you, Angela. I believe we may have
To
lost.
get,
Oh, there you go. Okay. I'm sorry. We lost you for just a second.
oh, okay.
Go ahead.
I was going to say boys, it may be a little bit more, it's for a teenage boy. I don't know if you are, if you found a therapist yet. Therapists, and you can actually filter it to specifically what you're looking for. Let's say you have, if you want a male, you check male. If you want someone that specifically and only deals with depression, you check depression. Eating disorders, you check. So whatever it is, it's filtered and narrowed to the point where you can fine tune. I mean, literally pick the exact need that your child has. And then the same thing, you can check for an adult, for adolescents, for a child. So that is a really great resource in finding a specific therapist and consulting. A lot of times if you just call just to consult, it's not out of pocket or in your insurance. A lot of the therapists will provide free consultation just so you can get an idea if this would be a right fit for your child. But if just from the information you're sharing with me about your son, I think that he should talk to someone, just given the fact of all of what you said. And he's got a lot that he's dealing with at such a young age.
And here's the last question. My 4-year-old daughter has been suffering from night terrors for the past 2 years. Is this normal?
For the past 2 years? Oh, wow. Okay. Is this, but that's, I mean, usually it doesn't last that long. That's not typical. How, have you talked with the doctor about it? A pediatrician at all? And is it 2 years consistently every night, or for 2 years, maybe?
She said she has, and the doctor said she would grow out of it.
Oh, okay. But is it something that's going on daily on a regular basis?
Is this daily? 3 times a week.
3 times a week? Hmm. And there's nothing that she's been exposed to that you think of, or is she like a separation thing? Has she maybe slept in the bed with you for a while, and then now she's got to sleep by herself? Or there's a lot of different questions that I would ask. Or has she seen anything? It's a number of different things that could be triggering
She
that.
said, yeah, she refuses to sleep alone.
Okay. So if
And
it's
she does
more,
not, and she says not that she's aware of anything that scared her, not that she's aware of.
okay.
Or he. It's an anonymous attendee, so I don't know the name. Just
Oh, okay. Okay. Well, that's kind of hard because I mean, at that 3-4-year-old age, I mean, they may not, they don't want to sleep. Sometimes they don't want to sleep alone, and it is kind of scary. So, that I would continue to monitor it. I'm glad you brought it up to the doctor. You can always get a second opinion if you still feel like, no, this is something else. I don't know. It's something that a lot of kids preschool age and older have gone through, night terrors, and it just kind of, some of them just grow out of it, or it just goes away. But then if it's something that's so consistent and constantly just the child cannot sleep, this is like causing major problems, I would maybe just continue to monitor. And then if it is something that you want, that try to see if there's something going on that they don't know how to express. Again, for a child that young, I always recommend play therapy. And if you could also email me so that I can share some of that, so some of those resources and play therapy, if that's something you want to look into.
okay. And I think we have a couple of phone call listeners, so I'm going to
Okay.
I'm going to say Angela's Dr. Floyd's email address is Angela, ANGELA Floyd, Floyd, and that will be at sdhc.k12.fl.us. And for those phone call listeners, again, this webinar will be available on our YouTube channel, and you can get to our YouTube channel through our main website, the Hillsborough County website. Just go to families and scroll down and guide through Title I Parent and Family Engagement. You'll be able to get to our YouTube page for the phone listeners. The other listeners, I posted that link in our chat room, and I just want to say thank you
Yes,
to
thank
Dr.
you.
Floyd for this amazing, informative webinar tonight. It was
Yeah.
very, very, very eye-opening and really something to think about. Families, I thank you for your participation. Again, if you have any questions, just reach out to Dr. Floyd via
Yes.
email, and she will be able to send you in the right direction with resources. She's going to email me that document, and I have all of your email addresses, and I'll be able to send those documents to you. Any last words, Dr. Floyd?
No, I just want to thank you all for being here today. Stay healthy and take care of yourselves, because I know we're constantly always taking care of our children, but really just pay attention to your own mental health. It's a lot of stressors that everybody's dealing with. So just you taking this time means a lot. So I appreciate you finding out more, and hopefully I was helpful. And please email me if you have any questions, and you can call me as well. So thank you again.
All right. Good night, everyone. I hope you all have a very well-rested evening. Take care.
Bye-bye.